Acne or pimples is a very common problem. If you are suffering from acne or pimples, then these simple tips advised by me will definitely help you in some way or other. So kindly listen to it. Number one, if you are suffering from acne or pimples, and along with acne and pimples, you are also having menstrual irregularities. Uh, Irregular menses, sometimes advanced, sometimes delay, sometimes the flow is very heavy, sometimes the flow is very scanty. Along with there is painful menstruation, also there is white discharge on and off. Then definitely there is some hormonal imbalance going on in your body, inside your body. So that hormonal imbalance is ultimately manifesting as acne in your face. So unless you treat the hormonal imbalance in your body, then your acne won't going to go away permanently from your skin. That's why if you are suffering from acne and simultaneously you are also having some menstrual irregularities, then definitely you should do first and foremost a pelvic ultrasound. A pelvic ultrasound should be done immediately after cessation of your menstruation. Along with the pelvic ultrasound, you can also do some blood test, especially hormonal blood test like luteinizing hormone, your FSH or follicle stimulating hormone, and DHEAS, your prolactin level, your thyroid stimulating hormone level, T3 and T4, fasting blood sugar and postprandial blood sugar, and also fasting lipid profile. And sometimes the doctor may also advise you anti-mullerian hormone level. These are basically a hormonal test which you should do if you are having acne along with severe menstrual irregularity or severe menstrual problem. And likewise, I said your pelvic ultrasound should be done immediately after cessation of the menstruation, and the blood test should be done on the second or third of the menstruation. And if in the investigation or in the reports it came out or it comes out as polycystic ovarian syndrome or polycystic ovary or polycystic ovarian disease, then definitely the doctor will advise you treatment or medicines, and with those medicines the hormonal imbalance in your body will get better, and gradually you will also see or witness improvement in your facial acne lesions. So that's the first and foremost point. Next is choosing the right kind of products for acne or acne prone skin or oily skin. Oily skin is most common in acne or breakouts, face or facial type. In those kind of situation, you should try to use some products which are basically non-oily. They are aqua or gel based, like soap free, like you can use a soap free cleanser or face wash, and you can wash your face twice or thrice a day, not more than that. Also you can also try to see ingredients of salicylic acid and benzoyl peroxide, etc. in your face wash or cleanser. It should be soap free cleanser. And also you can use some herbal or natural ingredients also, like tea tree oil, aloe vera, calendula, echinacea, and green tea extraction, barberries equifolium, etc. in your face wash or cleanser. Along with face wash or applying cleanser, you should also moisturize your face or skin. You can moisturize your skin or face twice or thrice a day after face wash or cleansing your face, and the moisturizer should be oil free. It should not clog your facial pores, which will eventually exacerbate the acne. So the moisturizer should be oil free, non-comedogenic. You should always remember that. And also the moisturizer can have some ingredients like niacinamide and alpha hydroxy acids like lactic acid, glycolic acid, and also hyaluronic acid, etc. as uh, associated ingredients. After that, I will advise you not to exfoliate your skin, not to do facial massage, which will eventually overactivate or activate the sebaceous or oil glands on your face, and which will eventually exacerbate your acne. Also, you should always maintain a good personal hygiene, like your bed sheet, your bed linens, your pillowcase or pillow cover, your mobile case or your mobile cover or your mobile cell phones, etc. should be always cleaned or sterilized, because those kind of products can accumulate, can trap bacteria and germs, and after coming in contact with your facial skin, you can have exacerbation or aggravation of your acne. So personal hygiene is very much essential in tackling acne. Next is, if you have dandruff, if you have seborrheic dermatitis on your scalp, which can also exacerbate or accentuate already existing acne. So if you have dandruff on your scalp, it can come down on your face. And that's why I will advise you, if you have dandruff or if you have seborrheic dermatitis, then always wash your scalp every day or every alternate days, so that the dandruff uh, keeps in control and your acne are not worsened. Next is, diet is important. You can incorporate lots of green vegetables, seasonal foods, etc. in your diet. You can avoid some foods, specifically sweet and high glycemic food, like white bread, pasta, and all kind of fast food, junk food, etc. Refined sugar, refined flour, cornflakes, uh, etc. comes under high glycemic food. You can avoid that. You can avoid sugar. You can avoid dairy items, like the products which are made from milk, and except buttermilk and curd. Buttermilk and curd you can have, but except that you can avoid all the other dairy products. And you can see, after after discarding those food, is there any changes on your of your acne lesions. Some patients get good improvement after discarding all these products, but unfortunately for some patients, even after discontinuing or discarding these products, they may not have those kind of satisfactory or remarkable improvement in your acne. So it depends upon patient to patient. Along with that, uh, you should always maintain a good mental uh, stress free level also. Sometimes what happens in cases of adult onset acne, that means acne when after 30 years or after maybe 35 years, those kind of acne is known as acne tarda or adult onset acne. In those kind of acne, there is always stress factors associated with it. Stress, anxiety, etc. are associated with those kind of acne. So if you have stress in your life, it can't be totally annihilated, I know, but still you can try to minimize the stress level of your personal life as much as you can, which may eventually help uh, in treating acne along with medications. And also, you shouldn't fiddle or manipulate your acne lesions on your face. Many patients I see, they have a habit of like touching the acne, like fiddling it and manipulating it. They try to extract out the internal infection or pus materials, purulent materials out, and eventually they can also develop post-inflammatory hyperpigmentation and scarring. So these kind of things you should always prohibit it. And what happens sometimes, if you experiment a lot with your skin, like you apply toothpaste, you apply some random home remedies like crude substances on your skin to get rid of your acne, and eventually it can lead to scarring, post-inflammatory hyperpigmentation, which means blemishes, and also your skin may burn, skin may develop contact dermatitis or irritant uh, dermatitis, contact dermatitis. So please be aware of that or be careful of that. Acne is a chronic problem, so your patient's level is very much needed in tackling acne, in treating the acne. So there is no very miraculous improvement within a short span of time. You should give at least some time in medical treatment. What I will say, at least minimum 2 to 3 months of medication is needed to see a good response in acne cases. So I hope this small and very simple tips will definitely help you in some way. If you have any query, any doubts, any questions left, you can tell me in the comment section. Thank you so much.